Loop was started in 2018 with a desire to kind of fix the Indian healthcare system. There were a bunch of problems in the healthcare system, as you know. Most of the care is really fragmented. There exists a lack of trust in big care programs and hospitals and doctors. Uh, there's too many unnecessary procedures, overbilling, and just lack of access to the right kind of care. So we wanted to kind of fix that. And the way we thought about fixing that is that you could combine insurance with great primary care. We thought giving access to affordability solutions that are provided through insurance and having access to doctors any time of the day, 24/7 throughout the year, would kind of help bring interventions into people's care journeys. So over the last 3 years, we've kind of provided these services to hundreds of companies, and over 500,000 lives have been using the Loop Health system. How we think about health assurance is primarily based on three pillars. One is insurance, which takes care of any kind of expenses that you have from hospitalization. The second is access to primary and preventative care. You don't want to wait for a surgery to happen to take care of your health. You want to avoid surgeries. You want to know much earlier if you have any healthcare issues. So we rely on a great team of doctors and a great diagnostics product to ensure that we catch conditions early, and then we can provide interventions. The third pillar of health assurance is technology. How do I use the data that we capture in a very proactive manner? How do we provide interventions to a massive group of people? For example, when we're working with companies, we see across the company staff, multiple people have either obesity, non-communicable diseases, or chronic conditions like diabetes or hypertension and things like that. So how do we kind of target these cohorts with specific interventions? That is where the data comes in. The other aspect of technology is providing great virtual care, use of great tools for our doctors to provide specific interventions for people's healthcare. So we feel like bringing these three together would actually provide an amazing new healthcare system for Indians across the country. So that's kind of our vision, how we want to get there. In terms of specifically from a healthcare perspective, we look at it as a holistic thing, starting from preventive, starting from dealing with sickness, and also helping people with their surgeries and any kind of hospitalization that are required. So it's a complete spectrum of care that is taken care of. We also want to look at holistic health and not just be there when people have conditions, not just be there when people have sickness to deal with. A lot of sickness can be avoided by inspiring people to lead much more healthier lifestyles. So there are a couple of programs that we at Loop have come up with. One is a great chronic care conditions product. So we launched Diabetes Care last year, which combines a great diagnostics checkup with a great consult with a diabetologist and a care plan which is provided by a coach who takes care of your nutrition and exercise requirements. So this is also provided through our app, and we've seen great results when people go through it for 3 to 4 months following the lifestyle changes. And a lot of the patients in this cohort have reversed diabetes or have reduced medications to a bare minimum. And in some cases, no medications at all. So that's one of the examples of our chronic care programs. We've also launched a personal care and elder care programs, which are targeted at people not having chronic conditions, but still want to kind of gain control of their health. Some of the innovations that we've been working on is providing people impetus for fitness. We launched a great Stepathon product recently, which kind of brings this gaming concept to a standard pedometer exercise. And we've seen great engagement and people being motivated to walk a lot. So we have a bunch of things like that lined up. In the future, we will see a lot more products that will work at the intersection of preventive care and chronic care, which will really help keep our population healthy.